Hi, I'm Matt, and this is Mark, and we're with Regenesis HRT, and we're a bioidentical hormone replacement therapy clinic in Pennsylvania. So, what are we doing today, Mark?
We're going to do a video on how to properly inject testosterone, intramuscular injection of testosterone.
And Mark, I've seen a lot of different videos online where I like one portion, but I don't like the other, like maybe the preparation for the injection, but I don't like the actual injection, or vice versa. So, what we wanted to do is really show you how to prepare the injection and give the injection in a way that we think is most appropriate for our patients.
Exactly, and most people find that the best injection spots are the deltoid, the gluteal muscle, and the thigh muscle or quadricep or outer portion of the quadricep. So those are the three areas that we'll be covering today. So
Okay, great. So here's your bottle of prescription testosterone therapy, and I would just say, it's important to always ensure that you're taking testosterone that is prescribed by a physician and dispensed by a legal pharmacy. There are so many underground steroids out there or testosterone treatments that people are using, and we're seeing a lot of infections, and people have to get parts of their muscle cut out as a result. So I would urge you not to use any kind of hormone or testosterone that is not prescribed by a physician or dispensed by a legal pharmacy in the United States.
yeah, so-called home-brewed testosterones or underground testosterones or other anabolic steroids that are purchased through the internet. Like Matt said, not only infections, we've seen people where they had to have drainage tubes put in because of massive infections, where the drug was falling out of suspension and solidifying. And, you have to think about, when you inject a drug like that, not only do you not know what you're putting in your body, you don't know what type of drug they're giving you, you don't know the dosage, and you don't know what that drug
Is contaminated with.
yeah, what bacteria is in there. They could have heavy metals in it, the metal content, and there's just a lot of very serious medical conditions that could occur through the use of them. So
Yeah, we've seen abscesses that have to be cut out and drained, as Mark said. So stay away from that. To save a few $100s, it's not worth it.
definitely.
So what you're going to do is you're going to take your bottle of prescription testosterone, and you're going to wipe the top with a sterile alcohol pad. And then what you're going to do is you're going to take a sealed needle and syringe. We like to use an 18 gauge needle to draw the testosterone out of the vial because it comes out much faster.
So you have an 18 gauge, needles. The higher the gauge is the thinner the hole in the needle. So obviously an 18 gauge needle is pretty thick. That's not something you would want to inject yourself with. But it's good for drawing out because you can draw the oil-based liquid, which is a little bit thicker and harder to pull out a lot quicker. And then use a 23 or 25 gauge needle, depending on what you're more comfortable with, in order to actually give the injection.
Right. So when you pull the needle out of the package, you'll find that it's a little bit loose. So just ensure that it's tight, and then go ahead and take the cap off.
Once you screw that on and off once for them too, to show. So I think sometimes people think these things click on.
Right.
And
So literally you can see that it has threads and it screws on and off. So you want to just make sure that it's tight and then pull off the cap. You can see how thick this needle is. It's not something that you want to inject yourself with. And then you'll take your bottle of prescription testosterone, and I like to go ahead and put the needle right through the top in the middle, and then I turn the bottle over, make sure that the tip of the needle is in the solution, that it's not above the solution, and then you can start pulling the plunger back. And let's say that you're going to inject 1 cc
or 1 milliliter.
or 1 milliliter, which is the same thing. You're going to go back to about 1.5 until it fills up.
And sometimes air bubbles, you'll see little bubbles form in here. If that happens, the best thing to do is like Matt said, draw back to either, if you're going to shoot 1 milliliter, go to 1.5 or 2. Flick the needle a couple times. Go ahead, and those bubbles will come right up to the top here. And then when you're pushing that back up to where you want it to be.
So I'm going to go ahead and push it back up to the 1 mark, and you're going to see that everything is going to clear out of there, any kind of bubbles or air pockets. And then I'm going to go ahead and just pull it out. So we're at the 1 milliliter mark, but we have to switch needles now. So what I do is I'm going to pull it back again so that whenever I unscrew this needle, testosterone isn't going to spill out of the top.
Because you're going to have a little teeny bit of testosterone that's in that cap portion of the needle. So if you don't pull that back and you take that off, you're going to lose a small amount of the drug.
Right. So I pulled it back, and you can see that there's a little bit of air in there now. I'm going to unscrew it. And then
you're going to discard this needle. Now, this needle was only used for drawing, okay? For drawing out the solution. You're done with this. This needle is now dull because you've put it through a rubber stopper. So this needle should now just be discarded. And we'll go ahead and discard that needle.
And you're going to discard that in a sharps container.
Yes.
And so these are 23 gauge needles, 1 inch 23 gauge needles. And I'm going to go ahead and take that out of the package. I'm not going to touch the part that connects to the syringe. And I'm going to go ahead and just screw that on nice and tight, right? And then I'm going to take the cap off. And then, since there is still air in there now because I pulled it back to ensure none spilled out, I'm going to go ahead and push it back up very slowly, and you're going to start to see the cap fill, and then you're going to just see a little drop come out of the top. And that's when you know that there's no air or bubbles left in the needle or syringe.
And you don't want to push out any more than just a drop. And a lot of times, if you do it slow enough, you'll see that drop just start to form at the beveled edge of the needle. Sometimes when it does that, you can actually pull back slightly and even get that back down into the needle. But at least you know it's right there at the top and ready to go.
Okay, so so now we've prepared for our injection of testosterone cypionate. And we're going to show you next how to actually inject the testosterone.